I'm Ted Schettler. I'm the Science Director of the Science and Environmental Health Network. My background is in both medicine and public health. Strong interest in environmental health as it relates to both clinical medicine and public health. I've been interested in impacts of the environment on human health and the interaction between humans and the environment for many, many years. And as we've learned, people spend about 90% of their time indoors, in the built environment. And so it seemed to me really important to think a lot about the quality of the indoor environment, just as it's important to think about the quality of the outdoor environment and how either or both of those might influence human health. So building environment, the built environment, and how it influences sort of the way we live our lives and move around has always been of great interest to me. The barriers that I have encountered myself, and that I suspect from some of the comments that have been made by others so far today, are that we're dealing with a lot of information gaps. We have a lot of very clever people who are designing new kinds of building materials, combining a whole variety of chemicals and materials in new and novel ways to create certain performance characteristics. But in the process of doing that, they're using materials and chemicals that we often don't know much about in terms of their safety profile. So we have a lot to learn about exposures as well as what some of the effects might be. And the barriers to that include lack of transparency. We often don't know what's in building products. Lack of disclosure about what's in building products, so even people who are interested can't find out. And then the whole need to figure out how to study them in terms of their safety, all the while we're having a lot of enthusiasm about getting new materials out into the market.